Have all supplies ready before beginning the insertion process. Your lenses, lens case, approved gas-permeable care solutions, artificial tears, a lens insertion and removal device if using one, and a mirror. Wash hands with soap and water. Rinse hands thoroughly to eliminate all soap residue, and then dry with a lint-free towel. If inserting the lens near a sink, be sure to cover the opening of the drain to prevent accidental loss if dropped. Instill 1 drop of artificial tears into each eye prior to beginning the insertion process. This will help to improve the comfort of the lenses. Open only one side of your contact lens case and remove the first lens. It is recommended to always start with the same eye each time to help avoid mixing up your lenses. Remove the lens from the case and place the lens on the tip of your dry index finger with the bowl of the lens facing upwards. Very important! Never rinse the lens with tap water after removing from the case. The lens may be rinsed with saline or your approved gas-permeable solution if needed. Inspect the lens for cracks or chips. Do not insert the lens if damaged in any way. While looking in the mirror, use the middle finger of the same hand you are inserting the lens with to pull down on your lower lid. At the same time, use a finger from your other hand to gently pull on your upper lid. While holding both lids open, insert the lens by using your index finger to gently place it on the colored part of the eye. Be sure to look straight ahead while inserting the lens to ensure proper placement. Once the lens is securely in place, slowly let go of both lids and blink your eyes. Repeat this process for the other eye. If the lens is accidentally inserted onto the white part of the eye, follow the instructions in the removal process to remove the lens, and then begin the insertion process again. To reduce the risk of irritation to the eye, do not attempt to slide the lens onto the colored part of the eye. Have all supplies ready before beginning the removal process. Your lenses, lens case, approved gas-permeable care solutions, saline, artificial tears, a lens insertion and removal device if using one, and a mirror. Wash hands with soap and water. Rinse hands thoroughly to eliminate all soap residue, and dry with a lint-free towel. If removing your lenses near a sink, be sure to cover the opening of the drain to prevent accidental loss if dropped. Prior to beginning the removal process, instill 1 drop of artificial tears into each eye. This will help to loosen up the lenses and make the removal process easier. Make sure the lenses are moving freely before attempting to remove them. Open only one side of your contact lens case so that it's ready once the lens has been removed. Opening only one side at a time helps to keep the correct lens in the correct side of the lens case. If using a lens insertion and removal device, hold the device in between your thumb and index finger with the cup facing your eye. While looking in a mirror, use the middle finger of that same hand to gently pull down on your lower lid. At the same time, use a finger from your other hand to gently pull up on your upper lid. Place the lens insertion and removal device on the surface of the lens. Once the cup of the remover is completely touching the front surface of the lens should adhere to the device. Gently pull the insertion and removal device away from the eye, which will remove the lens. Lift the lens away from the insertion and removal device. Place the lens in the palm of your hand with the bowl of the lens facing upwards. Place a few drops of your approved cleaning solution directly onto the lens. Use your index finger to gently rub the lens in a circular motion for approximately 20 to 30 seconds to clean the lens. Rinse the lens with saline or gas-permeable solution. Put the lens in the appropriate side of your contact lens case. cover the lens completely with your approved gas-permeable solution and then close the case. Repeat process for your other eye. If a lens is dropped at any time during insertion or removal process, clean the lens prior to insertion or placing in the contact lens case. If the lens is dropped with the bowl facing downwards, do not attempt to pick up with your fingers. Please use your lens insertion and removal device to pick up the lens to avoid risk of breakage. Excessive protein buildup may make the lenses uncomfortable and/or reduce the effectiveness of your treatment. Approved gas-permeable protein removers may be utilized to increase the longevity of your lenses. Ask your eye care practitioner for recommendations. Always follow the lens care regimen recommended by your eye care practitioner. Your doctor may recommend a different solution type or cleaning method compared to the method shown in this video. Contact your eye care practitioner immediately if your eye is red or irritated.